Yep, welcome to the Non-Sterile Compounding Lab in Penn. My student number is 241016CRR2. First step is to gather all information for the lab, and I already did that. Now the next step is, before I can do anything with the lab, is I have to perform aseptic technique with washing my hands. First step with that is to get a clean paper towel and turn on the faucet. Turn it to lukewarm. Make sure it's warm because that's the most effective way of killing any germs or bacteria. Next step, apply soap. Wash for about 60 seconds. 1 to 2 minutes is preferred. And the first step, get each finger to soap. And I know in a medical setting, you would end up getting a brush to go underneath the fingernail, but I currently don't have one, so I'm just going to modify, but you will get a brush there. And also, you can't have any jewelry on, like bracelets, rings, watches, or even nail polish, because that can cause some bacteria to build up. So it's best not to, you can't wear any of that performing this. And then also, you need to wash up to your elbows. That's in a sterile technique, but non-sterile, it's still good practice to do that, just to be safe. And then after about 60 seconds or so of washing everything here, next, you get another paper towel, wash your hands, like this, and then turn off the faucet with the paper towel for best sterilization. And then I'm going to let them air dry for a moment before I apply my sterile gloves. Now, part 2 of the video is to don the sterile gloves. So that means putting them on before you start anything here. Takes some time to get these on. Sometimes they stick to your fingers. You don't want to blow into them because it's cause bacteria. And then once you apply the gloves, next thing to do is clean everything. Here's the scale I'm going to use, and then there's the measuring cups. And next I'm going to clean the scale. Alcohol white, that's what they call them. Now once that's done, this lab is calling for a paste, which is going to consist of cocoa butter and petroleum jelly. Now off camera, I measured it, but I'll tell you the steps that I ended up doing. Now it said 240 grams on the sheet. And then this lab is calling for 40 grams. So then what I did was I did the math. 240 divided by 40 is 6. So then in the sample it said 30 grams of cocoa butter and 60 grams of petroleum jelly. That's the total number. Now what I have to do on this actual lab is divide each number by 6 to come up with my formula. So that means for the cocoa butter, I did 30 divided by 6 and got a total of 5 grams of the cocoa butter. After that, I did the petroleum jelly, and I did 60 divided by 6 to make 10 grams. So the petroleum jelly is 2 versus 1 for cocoa butter. And then that's a total of 15 grams in the actual medication. And then what I already did was I disinfected the wax paper here and put the medication on there. So that's a total of 15 grams. And then what I'm going to do here is double check myself weighing it on the scale. And it says 16 here because 1 gram of tear. So that's why I just made sure it's at the 16. So yeah, that's good. There's a 15 in total. And then there it is. So then what I'm going to do next is have to mix up the medication, and then I'm going to have to scoop it into this cup here. Yeah, I'm going to get this because I already used the spoon for mixing. Just got to open it. And I'm going to use this one in the middle here. This looks like the best one. And then I'm just going to scoop it into the cup. Get every last gram here. Mix it together. Make the paste. This is going to be a topical ointment for the patient, so I gotta make sure to mix everything for the proper ingredients. Just mix for a moment, make sure it's all good. This is what it looks like so far. And I'm confident enough that this is all mixed up and looking ready for the patient. So then I'm going to put it into their medicine jar. That's what where their prescription's going to sit. So now I have to carefully put the paste into the medicine. I'm going to get everything out. That way the ingredients are all accurate. It's that 15 grams that they were calling for in total. Get it all out, and then I'm just going to scoop it out of this. Trying to get everything possible. Yep, and that's good there. So now I'm just gonna put the paste in. And then just trying to make it look really nice here. So now that part's done, and then I'm going to put the lid on. There's the medication, and then there's the prescription, so it's for him. There's the name of it. There's the 5%, 15 grams in total. The expiration date is 1 year from today, which is August 7th of 26. And I'm going to simply seal it on there. This is for demo purposes, what it's going to look like. And then also what I did here is these couple of charts that the lab's calling for is to write the date of the compounded drug, which is August 7th of 25. One quantity, there's one. And then it's by me, the student, Sarah Brostek from Lakeview Pharmacy. Math calculations on there just so you can see how I did it. And then the final sheet. And the final video in this segment is going to be the pharmacy staff compounding log. This is very important because then it tells exactly the 2 ingredients that the patient needed for his medication. It explains the date. And then there was an RX number shown. You would write that down for the medication. And then the ingredient name, dilantin and zinc oxide was compounded. There's the 2 manufacturers, where they came from. There's the 2 lot numbers on there. And then the expiration date for each individual is in 2030. And 1 quantity was used to compound it. And yep, again, the expiration date for the medication is 1 year from today in August of 26. And there's the lab, there's the demos, and how to compound topical medication.